I presented the sub-analysis of ATIS-NVAF trials, which is a randomized control trial conducted in Japan of the design is oral anticoagulant monotherapy versus oral anticoagulant monotherapy plus antiplatelet therapy on and outcomes. Outcomes are there are several outcomes such as composite of ischemic and cardiovascular events plus major bleeding, and secondary outcomes is ischemic stroke and all-cause mortality. And the safety outcomes is a major bleedings and clinical non-relevant bleedings. So we focused on the systolic blood pressure at admission at study enrollment, to assess the how baseline systolic blood pressure modifies the combination therapy. We assessed the systolic blood pressure. We defined two different subgroups of normal systolic blood pressure groups and high systolic blood pressure group. The normal systolic blood pressure we defined under 130, and high systolic blood pressure is defined as over 130, according to the many guidelines. And in each strata, we assess the effect of combination of antiplatelet and anticoagulant therapy versus oral anticoagulant monotherapy. In an analysis we performed, Kaplan-Meier and Cox proportional hazard models using models. And we obtained some results, some important results. The first is regarding the primary outcome of composite of ischemic and cardiovascular events and major bleedings. In normal systolic blood pressure group show lower incidence of events in combination therapy. On the other hand, the higher systolic blood pressure was no difference, but combined them, there was significant interaction between normal and systolic blood pressure stratum and combination therapy. And we think combination therapy would be effective in normal systolic blood pressure levels as under 130. And regarding other outcomes such as ischemic stroke or bleeding, ischemic stroke or death, there's no significant difference, but significant difference. In addition, as for safety outcomes, normal systolic blood pressure levels did not change between monotherapy and combination therapy. So, in summary, our results demonstrate that combination therapy shows a benefit in normal systolic blood pressure group without increasing hemorrhagic events. So, although our results only used baseline systolic blood pressure, and the ATIS-NVAF trial was ATIS trial NVAF. Patients were followed for 2 years. So we have to analyze the longitudinal blood pressure data during 2 years. But at least our results indicate the baseline systolic blood pressure are affect protectively to protective for the combination therapy.